Hello, good evening and good morning, everyone. Welcome to My Heavy Offenses. We are here. We are very sorry for keeping you waiting. We definitely try our best to fix the problem. As you saw, we were not able to hear each other, and obviously that would be impossible to do without it. So luckily, as you can see, Dr. Lynn is right with us, and Louise is also with us. Louise Siwicki and Dr. Lynn Burmeister, is with us as well. So thanks everyone for waiting. We apologize, but I hope that you are ready to listen to our two experts today and are ready to learn, educate yourselves, and of course, you are here for the questions, I'm sure, as well. Louise, welcome back. And Dr. Lynn, this is your first webinar with My Heavy Fences. Thank you so much for joining us today. I hope you are both ready, because I know that it took us a few minutes at least to fix it, but we are here. I hope you are all good today.
Oh, good. Thank you so much for inviting me to join you tonight or today.
We are definitely happy to have you. And today we are going to talk about fertility awareness. And of course, Louise will talk about this holistic part, and Dr. Lynn will talk about medical stuff. So as you can imagine, you can ask anything. We are here for you. As always, remember, it's being recorded. And now we will start with the session. I think we are all ready. We've been waiting for that. But of course, remember that Dr. Lynn and Louise will start to give you some tips. This is something that I'm sure you are wondering about, what we can do to improve fertility and how to proceed. It's always the question, what can be done to improve your chances? But afterwards, as always, there will be time for your questions. As you know, it's a safe space. We want to answer any of the questions you have, any comments perhaps as well. So don't hesitate. It's all anonymous. So I think we can start with our session. Correct?
Correct. Thank you,
Thank
Caroline.
you so much. Let's go ahead.
Thank you, Caroline. And it's so lovely to have you here. Dr. Lynn, I really appreciate your time and your sharing your expertise, I guess, with us. It's something that I'm really excited to deep dive into. I first of all, I just want to, sorry, I'm just getting a bit of feedback.
I need to interrupt. Can you switch off your phone? I think you are logged in on your phone, and there might be extra echo because of that. So let's try to
logged in there
avoid that.
I'll turn my phone on.
Yeah, that would be great.
Yeah.
My phone should be okay.
Is that better?
Yeah.
Okay, I can hear myself. Okay, I just want to thank you so much, Dr. Lynn, for your time, and I just want to say how much of a fangirl I am of everything that you've painted. I just absolutely love how you've just completely reimagined fertility, I guess. You know, I struggled with fertility for 6 years, and we spent probably 5.5 years in and out of fertility specialist offices, and it was always, I mean, having a baby is meant to be a really exciting experience, you know, something that you feel a lot of love and happiness and joy around. And unfortunately, when it has to go to the next level and you end up in a fertility specialist office, sometimes, or a lot of the time, that is taken away. And that feeling, you know, you feel really isolated, you feel very alone, it feels very cold and very clinical. So I absolutely love what you have created. It's just over and above everything. It's a beautiful feeling that you've created. I sense the love, I sense the joy, I sense the happiness that you're trying to put into it. So for that, I thank you so much. You know, I think it's just, you should be really proud of yourself. And it's an amazing experience for your clients, and a lot of your clients are actually some of my clients as well. So
yeah, we share clients. Yeah. So yeah. Thank you, Louise, for helping our clients out as well, for offering them, the support as they need it, and just the mental health and wellness and sharing your journey as well with the clients. I think that's really important to know that you're not alone in this journey. Like, we know that 1 in 6 couples will need some sort of fertility treatment. And what I've tried to create is a beautiful space, so when the clients walk in, they feel like they're actually going into, a resort or the Qantas first class lounge or something. And I always, when I employ new staff, I just say, imagine you've bought a ticket to go to Paris and you're flying first class. Do you want the person at the front desk not to look at you or to ignore you or wait a minute or, I'll be there with you soon? You don't want that experience. You want someone who's lovely and greeting and really happy to see you, like not that they're annoyed to see you. So and that's the sort of space that we've tried to create, like that you're walking into a lobby of the most expensive hotel that you could find in the world, or it's the most important experience that you're going to go through, and we want to share it with everyone and make sure that everyone has a beautiful experience going through, even though it may not end up being a positive experience at the end. We may not be able to get you pregnant at the end.
Well, I love that. And for me, it's all about the feeling. I think the feeling is everything. And especially when it comes to, trying to make a baby, there's a lot of feeling there. And I think, but by creating the space and the feeling that you have, it really, it just goes a long way to really dissolving or trying to at least, the stress and the anxiety and the fear and all of these emotions that paralyze us over time if we've been going on a very long fertility journey. It really helps control those emotions and really brings everything. It's a great feeling of ease. So as I said, I absolutely love what you've done, and it is a credit to you and everything that you've built. So you should be really proud of yourself.
Oh, thank you so much. Yeah, thank you so much. So yeah, we've tried to create a really patient-focused, friendly environment, and I think that's important. And I know there are some clinics now starting. I've got my dog in the background. Sorry if he's chewing on something, but I know that's very important for, there are some clinics now, which is exciting, that are popping up, sort of like, modeling their model on my model. So because I think before I started my model, the clinics were very, medical, like, walking into a white room with, very sort of sterile environments. And I know my previous clinic, people used to dress up in white sort of sheet type outfits and with bows down the back of them, with their bottoms hanging out and having to walk down corridors. And that's certainly not the environment that we want to create at our clinic.
Yeah. Well, I love that. So like, it really just helps put what is already one of life's toughest challenges. It just takes that little bit of stress and anxiety out of it. So it's an amazing accomplishment. But I guess we're here to talk about, obviously, well, I mean, it's a very conversational style. So if anyone has any questions, please feel free to put them in the box. This is a safe space. We're here to help in any way, shape, or form. And I'm sure, Dr. Lynn, you also agree. But I guess the conversation we kind of wanted to start with was really around, what can you do? I mean, the importance of understanding your body and fertility and how it works early on, like starting the earlier the better. I mean, we kind of, like, if you're anything like me, I went on the pill when I was 17 because I didn't want to fall pregnant. I spent all of my 20s not wanting to fall pregnant, using and abusing the birth control pill like I really shouldn't have. And then when I went off the pill, I just thought that I would just fall pregnant. It just, after being on the pill for 16 years or something, and spending my whole 20s and mid 30s not wanting to fall pregnant, and then I just thought that it would just happen, and it obviously didn't. And I think for me as well, this is a really important discussion topic, starting the conversation earlier, as young as you can, understanding our bodies, understanding the history, what potentially could be preventing us later on in life from moving forward towards our dreams. Is there any medical conditions that we don't know about? Is there any mental health conditions that could be preventing us from moving forward? what are your thoughts on that, and really starting the discussion early on, and really understanding, because obviously, knowledge is power.
Yeah, I think it's very important. I think reproductive health is very poorly talked about in our teenage years. So we're taught at school not to get pregnant. That's the main topic when we're doing our sex education, and how babies happen, and how we have to prevent getting pregnant, and using protection and all those things. I think that's all important to teach teenagers, to be careful of sexual transmitted diseases, and to protect their bodies from getting chlamydia or gonorrhea, or other forms of STDs like wart viruses and herpes. I think that's all important, and that's good education. But I think education around also looking after your fertility health is really important as well. And I think I've seen even women or girls in their teenage years go into menopause. So often I've seen people that have come to or gone to their general practitioners and said their periods are irregular, and instead of testing or doing an ultrasound or checking their egg bank, they've been put on the pill, and then they come back to me 5-7 years later, their periods, they've come off the pill and they haven't got a period, and they're actually menopause. Now, if the general practitioner had thought about it when they were in their teens, maybe running some hormone levels rather than just putting the person on the pill, some hormone levels, the AMH, the anti-Müllerian hormone, that could have maybe prevented, well, it's not going to prevent them from going into menopause, but at that point, maybe those girls could have actually frozen their eggs. And we can't prevent menopause for some people, but we can also freeze their eggs if there is a risk of someone going into menopause early. And I think it's really important to know where your egg bank is. And I know I've got a 24-year-old daughter, so I know that all her friends, and herself included, have all gone off to check their egg banks. Now, some of them have come back in the lowish range, and so we're just monitoring them. But they've all gone off now because I think they know, that I talk about it so much. And they've all gone off and checked their egg bank. So that's the sort of message we want to get out to younger women, that you don't necessarily have eggs that are going to last to you're 40. You may not have eggs that are going to last to you 35. And certainly we know that after 35, your eggs aren't going to be as good. So if we can get your eggs and put them in the freezer between maybe even 28 to 35, they're going to be much better than a 40-year-old egg to work with. And I think it's very important to get that message out to women to get their eggs checked. Also to men as well, because men feel like they're sort of invincible and they're not part of the story. But we know that 50% of the time that they are actually part of the story. So smoking, vaping, excessive drinking, weight gain, illicit drugs like cocaine and things like that. We know that's going to affect their sperm quality. It's going to affect egg quality. And so, just looking after your eggs and sperm, it is very important for the babies that you're going to have in the future. I still have men that smoke or have changed from smoking to vaping because they think vaping is healthier, but it's actually not healthier. It's actually probably more damaging than smoking. So I think it's important to get that message out to both men and women that, look after your reproductive health by being healthy.
100%. And I think it's something that really for me, as I said, I went on the pill, and, I went and saw the GP, and they gave me a script, and I went to, I lived in a number of different countries, and all, I just kind of said to the GP, this is the pill that I want at this point in time, perhaps because my friend said, oh, this is good for your skin, or this is, so I just went and said, I want XYZ pill. And they were like, no worries, here you go, no questions asked. Didn't ask me how I was using it, or recommend that I should be using it or even ask why I was on it in the first place. And as soon as I went off it, I was told that I would get my period back straight away. There's no reason why you shouldn't get it back next month. There shouldn't be a problem. My GP said that. I was like, 2.5 years later, it took me to get a period back. And the GP was still saying to me, you should just get it back. It was about a year and a half into it that I obviously went and saw a fertility specialist, because that was the next step. But, you know, even in the beginning, if my GP had have said to me, look, you know, maybe this, you know, this isn't right, maybe early on, let's go and talk to a fertility specialist instead of waiting 18 months, you know, it was really tough. And, you know, I think you're right. I just think there needs to be more education and awareness around, like, I didn't really know how my body should respond, or I wasn't really at that point in time fertility educated as you know, how I kind of put it with my body. And, you know, I could have saved myself years and years of heartache if I had have been aware earlier on, or there had been more education.
Yeah, and I think the pill is a quick fix for everything. So I've got period pain. So what does the doctor do? Oh, we'll give you the pill and take the pill continuously, because then you won't get a period, and that will take away your period pain. But in fact, you might have really bad endometriosis that you probably need to know about. And we do know that it takes about 6 to 7 years for a woman to be diagnosed with endometriosis, which all that needs to be changed, because we need to diagnose endometriosis early. Maybe then the correct treatment is putting the person on the pill, but it needs to be diagnosed. So period pain is not normal. It's Endometriosis Awareness Month this month. So it's just a message out there to women that if you have period pain, it's very highly likely you have endometriosis as well. And it's not normal, and it can be treated. So it can be treated surgically, medically, and it's very important to treat it because it's destructive. And even though it's not a cancer, it behaves like a cancer, and it spreads into the ovaries and the tubes, and it spreads into the uterus, and it can cause a lot of inflammation and a lot of problems with you getting pregnant in the future.
So what do you, I mean, we've got a lot of our listeners are probably in their mid-30s, early 40s now, at the point where they are starting to become quite anxious and stressed, and it is becoming quite, you know, their fertility journey has probably been going on for a little while now, and, you know, it becomes like an insurmountable mountain, doesn't it? It just becomes all consuming. You become it's just, you can't see a light outside of your fertility journey, and you become really scared that you're never going to become a mum. You know, all of these feelings start to overtake your psyche almost. So what would you what would your recommendation be to, you know, our listeners who are 30, you know, mid-30s, early 40s, they're struggling, you know, they're probably, you know, seeing a fertility specialist, but what do you have any, you know, anything that they could do, any takeaways today that they can do to really enhance their fertility and you know, really increase try and increase their chances of falling pregnant and delivering a baby?
Well, I think, you know, very important is to see or seek, you know, the attention of someone that is actually willing to listen to you and willing to investigate why you're not getting pregnant as well. Is it a sperm problem? Is it an egg problem? Is it a uterus problem? Do you have like something wrong with your fallopian tubes? Is it an egg health issue, sperm health issue? Can you do some things in your lifestyle that might improve your fertility? So I think it's really important to see someone that's going to listen to you and do the appropriate investigations so that you know, you have the best chance of getting pregnant in the future. And they're simple. You don't always need to do IVF to get pregnant. There are more simple things, and it might be just simply, you know, we know that vitamin D, for instance, lowers your egg bank test, so your AMH is affected by vitamin D levels. So even just replenishing your vitamin D might actually help you get pregnant. So I think things like that, just getting all those checks done. We also know that celiac disease, which is very common, also causes miscarriages and infertility. And it's often not checked even by some of my colleagues that call themselves fertility specialists. So celiac disease is another thing to get checked out. Thyroid disorders. Some people don't even have their thyroid checked. So get your thyroid checked as well and make sure your thyroid is in normal range. But not only just your thyroid, also check your thyroid antibodies, because thyroid antibodies can be associated with miscarriages. So it's important to have all those very basic things that I think are basic checked out as well.
And for me, I ended up being diagnosed with celiac disease, as well as
Right.
I ended up with depression and adrenal fatigue, chronic fatigue, and in the end, celiac disease. And my fertility specialist actually said to me in the end, Lou, I can't see you for 6 months. You need to go and sort out your mental and your physical health, and I'll talk to you in 6 months, because this is never going to work. So thankfully, although that was at the time the most crushing thing that anyone could have said to me, that was definitely a sliding doors moment for me, because it made me really start to look at what was truly going on. I have a lot of clients, and they come to me and I'm all about trusting your intuition, trusting your gut, listening to your second brain. It's so important. I think a lot of the time we just put it off as, oh, it's just a niggling feeling, or I'm not going to listen to it, or there's something that doesn't feel right, and we kind of just put it to one side because we just do, because we're humans. But I have a lot of clients who come to me and they say, oh, I'm not really happy with what my fertility specialist is telling me, or I'm not entirely happy with the treatment I'm receiving, or the treatment plan, or there's just something not right about it. But because they've been with that person for so long, or they kind of have built a bit of a relationship, then they just tend to kind of just stay with them, when it's maybe not the right necessarily thing to do. What is your advice to someone who is potentially who's been with, under the care of a fertility specialist for a while, had a couple of rounds of IVF, but it's not sitting right, or it's potentially time to maybe get a second opinion? I mean, what are your thoughts on when
I think getting a fresh pair of eyes on your fertility situation is a really good thing. So getting someone, if it hasn't been working for a few cycles, 3 to 4 cycles, then just getting a fresh pair of eyes and making sure that everything's been done. Like, has your celiac antibody check been done? Like, I often see people that haven't even had that done. Or has the doctor checked your thyroid? Or is that thyroid range suitable for pregnancy? Do you have thyroid antibodies? I've even seen a patient for a second opinion who did IVF for a whole year, who was chlamydia positive at another clinic. So the doctor hadn't even checked to see if they had chlamydia. So simple tests like that. Chromosome testing. Have you had your chromosomes tested? I've also seen that before, where people haven't had their chromosomes. So sometimes just getting a second pair of eyes, because maybe the doctor's missed something. Like there might be something that's just been missed. And even things like, an endometrial biopsy. And I know there's lots of controversy around having an endometrial biopsy, but you can have a condition called endometriosis, which is an infection in your endometrium, and unless it's checked for, you won't know you've got it. And every time you put an embryo in on that lining that's inflamed and infected with a bacteria, you're not going to get pregnant. And it could be something simple like you've got endometritis. So all my patients will have an endometrial biopsy before they start their treatment to check for endometritis. Also natural killer cells, controversial, we all know that, but endometritis, and also to make sure that you can actually get their embryo back in. So some people come and see me for a second opinion and say, oh yeah, Dr. Lynn, the doctor really struggled to get my embryo in, and it took like 20 minutes, and they had to put me, on the side, or they did all sorts of things to get the embryo in. The embryo transfer should be really smooth and very, very easy. And if it's not, that's an alarm bell as well. So that could be why your embryo is not actually sticking, because the doctor spent some time putting the embryo back in, either using, instruments to clip the cervix and things like that. You shouldn't need any of that done. The embryo transfer should be the fastest process of the IVF journey. Yeah.
I've got Belinda has asked you a question. What do you mean chromosome testing? Is there a specific name for the test? We have been doing IVF for 5 years now in the UK. Just went to meet a new consultant in Greece last month for another opinion.
Yeah, so chromosome testing is called the carrier type. So it's basically checking if you're 46XX for women and for men 46XY. So just to make sure that you don't have any breakages in your chromosomes. So 4% of people trying to get pregnant actually have little breakages in their chromosomes, and they'll be infertile because of that, or they might have recurrent miscarriages. So that's a very basic test to have done to start with. And even if you've gone to Greece to get an egg donor or a sperm donor, I'm sure the Greek doctor will have done the chromosomes of the egg donor or the sperm donor. I mean, it should be a very basic first test that all infertility patients should do. And we're lucky in Australia that we actually get that test bulk billed, so it doesn't cost any money. Whereas in some countries, it might cost up to $1,000 to get your chromosomes tested.
Belinda, did that answer your question? I guess so. Yes, thank you. Awesome. I wanted to just, spin the conversation around to a little bit to the holistic, because I know that you are very for holistic treatment when it comes to fertility. It's not just physical, it's also obviously emotional as well. And there's a lot of stress and there's a lot of anxiety and there's a lot of all of these other emotions, fear, grief, sadness tied up into the fertility journey. What is your take on, or your opinion of, really looking at our fertility holistically and really supporting our mental health through the process? How important is that?
I think it's very important. So, diet and exercise and trying to, reduce your stress as much as possible, like being infertile or having that diagnosis over your head is probably one of the most stressful things that you'll go through in life. So there's major stresses in life, and one of them is cancer. And I did have a patient who was diagnosed with breast cancer, but she actually told me, when I told her that she couldn't have a baby because she'd gone into menopause after her breast cancer treatment, she actually said that being told that she couldn't have a baby was worse than her breast cancer diagnosis. So it is one of the major stresses of life. So I think, trying to do things to reduce your stress. So an anxiety level is very important. So meditation, a lot of our patients do acupuncture. And a lot of our patients even do things like, we've got in our clinic a skin clinic. They might do facials with our, dermal therapists and things like that. So we've got sort of extra things in our clinic that patients can actually, that they can do to help support their stress levels. We've also got yoga. We had a temporary stop on our yoga, but we're starting that back up now that COVID's finished. Hopefully, we are starting our yoga sessions back up. So we're starting fertility yoga again with Anjaya acupuncture. And so we're doing things like that to help reduce stress while you're going through fertility treatment. So stress is a major thing. And then looking after your diet. And then I also believe in packing people up with vitamins. So not just the vitamins you buy off the shelf, actually getting really good vitamins. So when you buy a lot of vitamins, they've got lots of different ingredients, but they're not really strong enough. So, we know that, for instance, vitamin E at 1,000 IU, which is a big dose, and you won't find that in a multivitamin, can improve your lining and can improve your egg quality. We know coenzyme Q10 or ubiquinol, not in the dose that you're going to find in a multivitamin again. You need big doses of it to improve your mitochondrial function in your eggs. So studies have shown that if you take 600 milligrams of coenzyme Q10 a day, you can actually improve the mitochondrial function in your eggs. So we know a lot of the multivitamins that are out there that say they improve egg and sperm function, probably the stuff you buy over the counter probably doesn't have enough. So you need to see a doctor that, you know, is going to recommend the right amount of vitamins to help improve egg and sperm. And sometimes you might need the help because your doctor may not believe in that. And so sometimes you might need to see the assistance or seek the assistance of a naturopath or an acupuncturist that can help you with those things.
Marie says, are there any specific foods or supplements that can support a healthy microbiome and improve fertility? They're kind of...
Yeah, so the microbiome of your uterus is, you know, no one actually used to talk about it, but now it's actually been talked about quite a lot. And that's why the endometrial biopsy, I think, is an important test to see what the microbiome in your uterus is doing. And if it is abnormal, so if you don't have enough lactobacilli in your uterus, so if that's low in your uterus, then that can cause failed implantation. So there are some really good probiotics out there. And again, I prescribe something to my patients to help them with their lactobacilli. So again, that's something that you need to speak to your doctor about. But there are some great foods that can help your microbiome as well. So like we know that yogurts packed with lactobacilli are good. Bone broth, even though some people find it disgusting, actually is very for your microbiome of your gut as well. And, you know, we know that kimchi, for instance, is good. So there's lots of foods that you can eat that will actually help the microbiome naturally within your body as well. So sauerkraut, kimchi. So I tell my patients to take 2 big tablespoons of kimchi every day. And try and improve their gut health, because we know a lot of inflammation that's in our body is coming from our gut.
Our gut's our second brain, isn't it? So
yeah, so a lot of well, yeah, it causes leakage, you know, of toxins through your body. So I think, you know, if your gut's not healthy, the rest of your body's not going to be healthy as well.
Absolutely. And Marie said how to check that, but I think you covered that anyway. Does that answer your question, Marie?
There's some companies that do check the microbiome. I'm not going to sort of plug any companies, but your fertility specialist will know what companies. There's all different ones around the world, and your fertility specialist should know how to check your microbiome of your uterus.
Does that answer your question? Oh, awesome.
Yeah.
Does anyone else have any other questions regarding anything to do with supplements or how to support your fertility in a holistic way now that we're kind of on this track? Does anyone have any other questions?
Someone's typing questions. I always say to the guys as well, so the guys often don't really take much notice of their health as well. So I always tell the guys to, you know, look after their fertile health as well. And many men are very sedentary. They're sitting at their office or, you know, in their office most days. Or, you know, they might be Uber drivers, taxi drivers, driving in trucks, overheating their testicles. So I always tell my men to actually ice their testicles at least 20 to 30 minutes a day. So have an ice pack in their freezer, wrap it in a towel, plonk it on their lap while they're watching TV at nighttime. Obviously not naked, but, you know, just on top, just to cool the area down. And that we do know that that can help sperm DNA and also improve sperm DNA fragmentation. So I think that's important to remember. 50% of the embryo that you make is going to be about your sperm health, and 50% is going to be about the egg health.
Would you recommend patients to do a sauna or hot bath?
No, probably not. So no, you're better to do an ice bath. So you're actually better to, you know, actually have ice baths and do ice baths rather than have saunas and hot baths. I think if you're in between cycles and you want to do a sauna and you want to sweat out some toxins or something, then that might be all right if you're a female, but not for guys. Anything that overheats the testicles is going to cause increased DNA fragmentation. And remember, it takes 90 days to make your eggs and 90 days to make your sperm. So at the end of the 90 days, we want Olympic athletes at the end of the day. So if we get Olympic athletes in our IVF lab, we're going to be able to make you a better embryo at the end of that end of that 90 days. So we want you to be in your prime shape by the time you're ready to start your IVF cycle.
Does anyone else have any questions? Amal, did that answer your question? Somebody is typing. We've got another. Do you recommend a supplement called spermidine?
Spermidine, I'm not exactly sure what's in spermidine. I don't think that's an Australian brand. But again, a lot of the things that you buy over the counter don't have much stuff in them. So you're actually better to get a list of the vitamins that will help, and take them individually. Like, get the zinc individually with some vitamin C. So get a list of all the things that will help your sperm and buy them individually, so you get the high doses that are going to work well. And also get good brands of your vitamins as well. And that's where you need a doctor that knows what to recommend, or a naturopath or an acupuncturist that knows what to actually recommend. And I'm not, spermidine may be great, but I'm not aware of that particular product.
I am. When we were trying to conceive, I actually went and saw, well, I was seeing an acupuncturist at the time. He was amazing. I saw him once a week, but I also saw a naturopath that specialized in fertility, and she was amazing with the supplements that she recommended. To me, it was all, she specialized in fertility. She knew exactly what she was talking about. And she prescribed me all of the top quality brand. So I knew that what I was getting was going to be the best for my body. It was top quality, it was high strength, and it was definitely something that made a lot of difference. So just making the effort to go and see someone, if your fertility specialist isn't across it, who actually specializes in the fertility supplements, is just, I think, so important.
And someone's popped up a question about melatonin. Yes, so melatonin is actually good for egg and sperm health. We know that melatonin is a very powerful antioxidant. So again, just like all the other antioxidants like vitamin C, vitamin E, coenzyme Q10, they're really good antioxidants for your egg and sperm health. So yes, I give my patients melatonin as well. So usually around 4 milligrams in Australia. It's only available via prescription. In some parts of the world, you can just buy it over the counter. In America, you can buy it at a dose of 10 milligrams just over the counter, whereas in Australia, it's actually only a prescription-only medication.
What do you think of
homocysteine?
Yes.
What do you think of homocysteine? Can it cause? Yes. So homocysteine can, and it's certainly something I will investigate when someone's had miscarriages. I don't normally do it as part of my baseline fertility investigations, but if someone's had miscarriages, I certainly check for homocysteine and MTHFR. So MTHFR is the gene that metabolizes your folic acid and turns it into folinic acid, which is the final version that's going to work to help prevent spina bifida and spinal cord defects, and it will also lower your homocysteine levels, so actually help lower your chance of having miscarriages as well. So that's something certainly I would check if people have had miscarriages. And you can also ask your doctor to check for it if you are struggling to get pregnant as well, because maybe it may be preventing implantation. Certainly if I have a patient that has failed a couple of cycles of IVF, I will do a whole panel, including the homocysteine level and the MTHFR level. So also anti-nuclear antibodies, protein C, protein S, antithrombin 3, prothrombin gene. So there's a whole list of blood tests I will do if someone has failed a couple of IVF cycles.
Acupuncture, do you offer that? You do offer it at your clinic, you did say, and do a lot of patients decide to try it? How often? I've never tried it before.
So yes, a lot of our patients love the acupuncture. Now, again, if you look at the scientific data around acupuncture, there's not great evidence either way. There are some papers that say if you do it once a week leading up to your IVF cycle over 8 to 10 weeks, you'll improve your chances of getting pregnant. However, there are other studies that say it doesn't do anything. So there are some people that are big believers in acupuncture. I think it's very important to remember with a lot of the IVF trials that are done, it's very hard to prove something works because you'll have to have a placebo arm and then you'll have to have the acupuncture arm. So it's very hard to have a placebo arm and an acupuncture arm to get a proper randomized controlled trial that will prove whether acupuncture will work or not. But we offer it in the clinic and our acupuncturists are great. And we also, I can recommend other acupuncturists around where we live that are great as well if patients can't come into our clinic. But yeah, many of my patients and clients love doing acupuncture.
I was the same. I think it really, I think over and above everything, I don't know whether it made a difference to my fertility as such, like you said, but it certainly helped my mental state. It really allowed me just to relax. And even in I've got a lot of clients that are A-type personalities, so they go, they can't ever shut off. And that is the one thing where they have to sit still. They can't move because they've got needles everywhere. And it almost forces them to stop and relax for that 45 minutes. So that a lot of my clients do it for that exact reason, because it forces them. There's no other way but to stick needles in their body so they can just be calm for a period of time.
And I know our acupuncturists will do a lot of mindfulness with the patients as well. So, just speaking to them, because sometimes fertility specialists, we're running around busy. We might have a patient who we've just seen that's having a miscarriage. And so whilst we're trying to give you the attention that you need, we're also dealing with a patient in the background that's having a miscarriage or an ectopic pregnancy or something's gone wrong. And we're trying to deal with that. So the good thing with acupuncturists, they actually often have more time to spend with you to talk to you about your mental health and well-being as well.
Absolutely. And I think it's so important to look at your fertility in a holistic way. The mind and the body are interconnected and one doesn't work without the other. So looking at your fertility in a holistic way is so important. Really, I think for me, it took someone to kind of say, hang on, you need to sort out your mental health before before you can move forward. And I only wish that I had have considered my mental health as an important part of my fertility journey earlier on, because it would have saved me so much mental anguish, so much stress, so much anxiety. It would have saved me from falling into the depths of depression. So if everyone is listening, be very mindful of your mental health through this process as well. You don't have to be strong. It's okay to say, you know what, I need help, to pull together a team of professionals from the holistic point of view and the medical profession as well to help you move through, like we've said, what is one of life's toughest challenges. I mean, it is tough, and it's hard, and you don't have to hold it together. You can ask for help, and it's okay to say, I'm not okay, and I need help from a mental health perspective as well to ensure that I can see this journey through.
Yeah, there are some patients that are so anxious and so stressed and so depressed that when you're putting an embryo in, you feel like you're putting it in a furnace. And you can just feel their energy when you walk into a room, that they're just like, so emotional and so stressed out. So there are many patients that I've actually told that, you might need just a small dose of antidepressant just to get you through this phase in your life. And when I've told them that, they've actually got pregnant. The ones that I can feel the energy where they're really, really depressed, or, their energy is so bad that you can actually feel it coming out of their body, or they're so angry, or they're, mean to the staff and things like that. It's and that's what I often tell my staff. If a patient's being mean to you or something, it's not about you. It's not about, it's more about what's going on in their life, and they're just expressing their emotions at you. And sure, unfortunately, you're going to have to cop it sometimes, but it's usually something to do with them, not you. Like, it's not that you've been mean to them or anything like that. It's usually got to do with their mental health, that they're hitting out at you. And unfortunately, some of the staff do cop some of the emotional things, that emotionally charged people that are going through this journey as well.
It's hard, and if you don't, if you have got yourself to the point where you've almost hit rock bottom, or you've been, you're on that borderline depression, or whatever else comes with it, it's so your brain is in overwhelm, isn't it? You can't control your emotions almost. It's just, you're just triggered by anything, and you want this so badly, and you've got to the point where you just can't see a light outside of infertility, and without the right tools and strategies, and really, taking a step back and saying, what, I need to look at this, in a holistic way, and do some mental wellness, mental health work. Sometimes it's like putting an embryo in a furnace, and it's really hard when it's not always, it's really hard to move forward on your fertility journey and fall pregnant and become a mum when you're in this constant state.
Yeah, and I think that's important, like what you do, Louise, is, help and guide people through that, because, as I said, a fertility specialist may not have a lot of time to help and guide you through that mental journey as well, because we have got lots of other things going on. I know, for instance, tomorrow I've got to go to work early and do a scan, and then do 10 embryo transfers, and then egg collections, and then see patients. And, I'm going to try and give everyone my best tomorrow, but, I may not be able to help with them with all their mental health issues that they're dealing with, to get them through to the next stage. And so seeing someone like you, Louise, to help coach them through that is very, very important.
I think, for me, it's about just creating a safe space for women and men. I have clients who are men as well. It's 50% male factor as well. And I think the men often, from a mental health perspective, really struggle more, because they don't feel like they're allowed to express their feelings. They're just there to support their partner. They're there as the support person, but they don't feel that it's okay, that it's their place to be able to express their emotions, because they've got to be strong for their partner who's going through all of the medical treatment. So I sometimes think it's a lot harder for the men, because they don't feel safe to express their feelings. But I think for me, it was something that, fertility coaching wasn't really, a thing 10 years ago. Even mental health, when it came to your fertility, was not really talked about or really considered as something that was important. So for me, I know where I got to rock bottom, and I know that if I had have taken the steps earlier on to really create a team that, from a mental health perspective and a physical perspective, that was going to help me move forward, I wouldn't have got to the place that I was emotionally, and I wouldn't have had to hit rock bottom, and potentially my fertility journey would have looked a lot different. So I think that's why I'm so passionate about really supporting women and men through this process, because you can successfully navigate your career, life, and your fertility journey at the same time. You can connect in with your happy heart, and you can there is a life outside of your fertility. It's just sometimes you need that support to guide you, to show you with tools, strategies, to be able to guide you to that place where you can think clearly and you can then successfully navigate both. So I think, it's for me, that's why I'm so passionate about it, and that's why I feel it's just a really, it's just another piece to the puzzle, isn't it?
Someone's popped up a question about uterine PRP and immunological treatment when you have recurrent implantation failure. Yes, we do uterine PRP, so that's where we get your platelets and we pop the platelets inside the uterus. Not so much for implantation failure, but more for lining thickness. If people have thin lining, which is another common cause of infertility, having thin endometrial lining, we have found that PRP can actually improve the thickness of the lining. And also we do look at immune protocols for people where we think there might be an immune cause to their infertility as well.
There's another, you mentioned antidepressants. Can you please explain more?
Yes. So again, I don't prescribe the antidepressants. So usually I will refer on to a maternal, fetal medicine psychiatrist that specializes in that area, and they'll give the patients, a safe antidepressant to help them, or give them the correct antidepressant. And some people find that once they're pregnant, they actually feel happier, so they can actually come off them or wean themselves off the antidepressants. But I don't prescribe them myself, but I will tell a patient if I think they need them.
Is there any more questions? I think we're going to finish in a minute. Does anyone have anything else for Dr. Lynn or myself, or before we wrap it up? No? Well, I just want to say thank you so much, Dr. Lynn, for your time today. It's been such a pleasure. As I said, I'm a bit of a fangirl, so I was really excited when you said yes. I just love what you've done. It's just really, like I said, I'm just all about the feeling and really creating a special, falling pregnant and delivering, becoming a mum and dad is just one of, there's just nothing like it. So I just think, for you to really create a safe, beautiful, empowering space for people who are struggling is just, you just cannot put a money figure on it, or you just can't. It's priceless. So thank you so much, and I'm so excited that you said yes to doing this with me. So thank you.
Thank you so much, Louise. It's been a pleasure, and thank you for everything that you do as well, to help people through and navigate their journey through fertility, because it's not an easy journey. As I said, it's one of the biggest life stresses. So and being diagnosed with infertility, as I said, is like almost, I don't know, I haven't been diagnosed with cancer or infertility, but I would imagine they're two of the biggest life stresses that you could face.
Thank you so much, both to you, Louise and Dr. Lynn. It was lovely to have you for sure. It was definitely an interesting session. Good questions. And of course, we hope and we do believe it was useful and helpful for you. And we, as always, we encourage anyone to join us. As you know, we will have more events, more topics. And thank you so much for helping us out here today as well. And of course, I'm looking forward to some more events like this. And thank you both. It was lovely to have you for sure. Everyone, as you know, we will be back next week. So don't hesitate if you haven't signed up yet. Go ahead, do it. And of course, one more thing I would like to say before we finish for today, you will be redirected to our survey. So feel free to share your feedback. What do you think about our webinar? Simply just because we want to improve, we want to provide as many topics as possible, just to give you the opportunity to get your answers. That's why we are here, and we want to continue this. So thanks everyone for joining us as well. Again, Louise, Dr. Lynn, lovely to have you, and have a lovely evening as well. Take care, everyone.
Bye, everyone. See
Bye.
you.
Bye.